Can we continue to do what we're doing today and sustain our healthcare system? Can we continue to do what we're doing today with the drivers that are impacting healthcare today and make sure that our hospitals survive in the future? If you look back to 1970 and fast forward through 2010 and compare the growth of healthcare expenditures to the growth of our entire economy, you can quickly see why the question of sustainability comes to bear. I mean, in 1970, if you use that as a baseline and fast forward for the next 40 to 50 years, you will see that the growth in healthcare expenditures has outpaced the entire rest of the economy almost 5 times. So those 2 data points, the cost of debt, the growth of debt, and secondly, the growth of healthcare expenditures far outpacing the rest of the economy, has caused our nation, especially our policymakers, to say, whoa, this is an unsustainable environment. We have to do something different. In fact, if we don't do something different, we could have a financial catastrophe in our country. So 3 years ago, this piece of legislation was passed. We all know about it, called the Accountable Care Act. And when you think about kind of the goals of that act, you can kind of summarize the 1,800 pages, at least from healthcare's perspective, into 4 major goals. And I'm not going to go into a lot of the intricacies of the legislation this morning because you don't want me to, and you've read about it and you've heard all about it. But I think it's important that we discuss these 4 goals briefly because the implications to our hospitals and our physician practices over the next decade are really rooted in these 4 goals and how we address the changes that are going to take place around these 4 goals in the next decade will truly spell whether our hospitals are successful and our medical practices are successful. So the 4 goals of the ACA, we all know them well. First, and by far the one that drove everything else, was to provide greater access to care, especially to the approximately 50 million people in this country who have no insurance of any kind or who are significantly underinsured. So broadening access to care was clearly the linchpin of the legislation. Secondly, to slow this unsustainable growth in expenditures, a very major goal. Now, we can argue whether or not that goal has been successful to date. In fact, most economists and even policymakers believe that to date, the legislation has had very little, if any, impact on slowing the growth of healthcare, although last year, for the first time in 50 years, the growth flattened out. It didn't continue to grow at the rate that we've seen over the last several decades. The third goal was to improve the affordability of care. In other words, for those people who are at the poverty level or 400% above the poverty level, provide them some assistance so that they could buy insurance and have coverage for themselves and their family. And to improve that affordability through subsidies, tax credits, other things like that, again, was an important part of improving access to care. And finally, as we know, this whole issue over many people believe if you can improve quality, if you can improve the efficiency of how we deliver care in our country, we can then reduce cost. So quality has a huge piece of the foundational play in the legislation. But as I said a minute ago, even if the legislation hadn't passed, we would still be facing these issues as an industry. Hospitals clearly must rebalance their cost structure. Now, as an economist, when I say something like that, people think, well, Mickey, we've been cutting cost every year forever. I know you have, but I didn't say cut cost. I said rebalance your cost structure. What that means in economic speak is that hospitals in the future will no longer be able to be all things to all people. As we improve access to care, as we provide more coverage to people who today don't have insurance, right? An interesting thing happens people say, Mickey, we've been providing health care for the uninsured forever. I mean, they come to our EDs, they come to our physician practices, and we provide care to them whether they have insurance or not. Yes, you do. It's the noble thing to do. It's the right thing to do. However, one of the things that we know, when people get insurance, the utilization of care increases every time. And it especially increases at the primary care level. And the facts are, and you know them better than I, we're not producing enough primary care physicians in the United States to meet the current demand, much less when 30 or 35 million or 40 million people all of a sudden have health insurance. So we put together what we called a blueprint of 7 imperatives that our hospitals, and in fact, every hospital in the United States, really needs to be following and needs to be aggressively pursuing if they expect to survive and prosper in this era of reform, if we could call it that. The first one, and clearly the foundational strategy, of which many of you in this room are working on today. You may never considered it this way, but I promise you that everybody in this room is intricately involved in this strategy, and the future of your hospital is dependent on how well you do here. Because this is the foundational piece, it's the first imperative, and it says we must move to this sustainable model, there's that word again, of clinical integration. Fourth imperative, protect the revenue cycle. Wow, Mickey, that's pretty profound. Cash has always been king in America's hospitals, so shouldn't we have always thought about protecting the revenue cycle? When in fact, we haven't in America's hospitals very often thought about protecting the revenue cycle until today. Why? Because more and more of the payment, as we talked earlier, of care is being transferred to those of us in this room. If we can't be all things to all people, and if there's things we need to be getting in and getting out of, how can we do it and still sustain our organization long term? Well, a key strategy for most hospitals in this country is you're going to have a partner to help you do some things that you otherwise might try to do yourself today. So your ability to diversify, in terms of the clinical setting or even the backroom and business setting, to help you do some things that you just simply cannot do by yourself. A perfect example is why you're here today. If physician recruiters today could go out and recruit doctors on their own, they wouldn't need CompHealth. But you can't, so you diversify and you bring in this backroom talent that stands with you to help you achieve things in recruiting that you simply couldn't do on your own. We have to plan as organizations and as medical groups for an incredibly robust expansion on the outpatient side of healthcare. In fact, if you look, most of the pundits in the country today believe that inpatient medicine, as we know it, will continue to decline somewhere between 2 and 4% every year for the next 10 years. Whereas the growth in outpatient services over that same period of time is expected to be somewhere between 30 and 40%. Our guidance to hospitals and to medical staffs and certainly medical leaders and importantly to boards of trustees is pretty simple. First, the status quo is no longer a strategic option. Thinking that we can kind of operate and tweak around the edges, the way we've done historically, will not allow us as organizations to be successful or even survive in the long term. Secondly, this whole issue of rebalancing our cost structure also means we have to rebalance our role in the community. Think about that for a minute. We not only have to rebalance our role in the community, but we've got to rebalance our community's expectation of us, right? And finally, just as this whole imperative of the physician alignment was job one, the foundational strategy, it is really the final guidance here is achieving true alignment with the physician will really be the market differentiator. Those of us who can do that, all right, and reduce practice variation and really control the health of a population will be those that survive and succeed going forward.